Hi, and welcome to another episode of What's Up, Dr. Dovec. I am Dr. Dovec. I'm Betsy Dovec. I am a bariatric surgeon, but today I am going to talk to Dr. Elizabeth Carr. Dr. Carr, in her day job, which I guess is all her day job, she is a pulmonologist and critical care specialist in internal medicine. So that means she focuses on diseases of the lung, and she has a particular interest in sarcoidosis. We'll talk a little bit about that, but she is also the newly appointed GBMC Internal Medicine Residency Program Director. And we're going to talk to all of you out there who might be United States medical students or maybe even international students who are watching Dr. Carr and looking into doing their internal medicine residency here at GBMC Hospital. So we're going to talk a little bit about the process, about the program, about what makes GBMC Hospital a no-brainer when you're doing the match process and ranking it numero uno, and why you should come here. So Dr. Carr, welcome. Thank you for being here.
Oh, thank you so much for having me. I'm really excited to talk about our program and to get to talk with you.
Oh, excellent. Well, thank you. So let's start off with the program. So I want to explain something to our viewers. Maybe some of you out there just stumbled across this video and you are a prospective patient of GBMC and you just wanted to see it. But maybe some of you out there, like I said, are medical students. So let me explain the process of what it takes to become a specialist physician. So if you're deciding you want to go into this field of medicine, what you do first is you go to college and you can major in whatever you want, but you do have to do the requirements to sit for your MCAT examination and then ultimately go to medical school. Once you get into medical school, you will do several different clinical rotations. You'll learn a little bit about surgery and OBGYN and internal medicine and family practice, and it goes on, and you decide, okay, I know what I want to be officially when I grow up. I know what I want to be in terms of how I want to practice medicine. So then after medical school, you will then do training, internal medicine residency training. And that whole process, we're going to explain a little bit now. So if I am in my third year of medical school and I know I want to do internal medicine and I'm looking at different residencies, Dr. Carr, how do I get my application to you? Do you guys participate in the match and ERAS? Like how do you do it?
Oh, those are great questions, actually. So the first thing you want to do, you complete all of your core requirements during your third year, which will include your 8 to 12 weeks, depending on which program you're in, for internal medicine. And then in your fourth year, you do your sub-I in internal medicine. And these are the sort of necessary components that you have to have. You'll have other requirements too. You'll do your surgery, which is what you did and obviously ended up where you are. And so once you're in your fourth year, you then obviously start to get your information. You look at the website, you can start asking some friends, you talk to people, you talk to your dean at the school. They will then help guide everything. You do the ERAS application process, and you match with the NRMP. So we do, like every other standard program that's accredited in the United States, you go through the NRMP, and then you have your fabulous match day, in March. So
yes, I remember match day. That is a day that has so much anxiety and excitement leading up to it. And you just pray that in the middle of March that you open that envelope or receive that notification that you matched and that it's where you wanted to go, because you do rank it. So the applicant or the medical student who will become the resident ranks theirs in order. And then of course the program ranks, and then you hope that it's a perfect batch, that the number ones will pick the number ones and it's all perfect. So I saw on your website, which if you're out there looking to be a resident in this internal medicine residency program, I saw some of your criteria to even get accepted for an interview. You guys are tough. You're tough. Your step 2, USMLE step 2 score minimum. Did you know that you had a minimum of 230 or you won't even interview the applicant?
Yeah, it's one of these a little bit of an arbitrary cutoff because we certainly do believe in standardized testing as part of creating a uniform platform from which to go because people go to medical schools in all different places around the United States, but all different countries. And so to have a uniform standardized test is really the only way that we can kind of even the playing field. However, the application is so much more than just your USMLE scores. Your step one scores are what you take at the end of second year in medical school. And they're a big deal. They really represent your basic science knowledge. Then you take your step twos, which are your more clinical, like how do can you interact with patients well? Do you have the clinical skills? Do you speak the language? Things like that. Those are all really important. And for us, we look at a lot of different things, but we do have brilliant physicians here in training. And so we really do like to hold the bar high.
I can attest to that. I will tell you, I have seen and had some unbelievably amazing young physicians make some incredible diagnoses, take care of my patients if asking for consultations. I've interacted with them, and I'm always very impressed by the quality of the internal residency program. I truly am. So if an applicant, a new resident, they do internal medicine, what is their experience like in terms of the rotations, the clinical mix? How do you break that down?
Yeah, I remember actually when I started my internal medicine residency, all I could think about was intern year. What does that intern year look like? Because it is the big looming thing. Our internal medicine residency is a 3-year program. You do 1 year as an intern and then 2 years as a quote unquote resident, although really you're a resident the whole time. We do have categorical, so they are 100% internal medicine for all 3 years. And we also have prelims, so people who might go into some subspecialties. For example, we have ophthalmology, dermatology, radiology, neurology, and others. So anesthesia is another one. You go through your 3 years of training, and it's going to be a little different, obviously, for a prelim person who's in the prelim program because their whole goal and focus is different. So I'll talk more about the categoricals just because it's a little easier to kind of focus on that. So in your first year, a lot more clinical time in the hospital. So you're really spending a lot of time talking to seeing patients in person. You're going to be rotating on the floor or the wards, basically, where you will carry somewhere between around 7 to 8 patients in a day. And you'll send some healthier patients home and you'll get some newer, sicker patients that day. And then, so we'll be broken up with about 2 to 3 months of the floors, we call it. And then you'll have 2 to 3 months of ICU time, which is intensive care unit, which is where we really have phenomenal teaching happens there because it's an intense place all around. And there's a core group of people that work there with an intensivist. Then you'll have time where you do a continuity clinic. And that continuity clinic is very unique here at GBMC. It's a clinic where you'll see patients in a longitudinal way. So you start off with a patient on day 1, and you will be with that patient for the next 3 years. And so you really develop a great relationship with them. That clinic, actually, you'll do 1 week every 6 weeks, which is phenomenal because when I was in training, it was sort of thrown into whatever part of my schedule. So this is great. It's dedicated time, and it really allows for a great relationship with the outpatient attending as well. So you develop that one-on-one with that person who's going to coach you through your training experience. So, and then you also have elective time where you say you want to do something, you want to spend a week doing pulmonary, for example, you might do that. So that's where you will start to learn about the subspecialties from internal medicine. And then that basically gets carried through and a little more emphasis on outpatient time as you go through your 3 years. We aim for a total of 50% inpatient and 50% outpatient, which is really the golden arch for everybody at this point. We really are hoping for all programs across the United States to get to that benchmark. And we've been able to create a schedule like that. Unfortunately, right now with the pandemic, that's put our schedule implementation on hold a little bit, but we really are getting towards that 50-50, where you do 50% inpatient, 50% outpatient, and that gives you the best chance to become the best doctor from there.
Yeah, I mean, GBMC Hospital is an absolutely fantastic hospital. The clinicians are superb. I think that it is a community hospital, but it is in a very densely populated area. We see some very unique disease states. We see the bread and butter type things. I think the experience is robust from, like you said, a typical scenario to the critical care side of things, the ER side. So if you're doing internal medicine, and like you said, there's the potential to do some elective type weeks in it. So you're saying that if I wanted to be, let's say, specialize in cardiology or pulmonology like yourself or endocrinology, there was the opportunity or is the opportunity that I can spend additional time with those people to establish them as mentors?
That's exactly right. And so you'll be able to take time to do any of that stuff. We have all the subspecialties within internal medicine are offered here at GBMC, so you can actually spend a week doing that here, a month doing that here. You can actually, even for second years, we like to be able to give an opportunity for them to go to a university setting to be able to have another experience outside and sort of see what that's like so that they can decide what they want to do. I think it's really important, actually, for an internist, even if you're just going to do regular primary care, no matter where you are in the United States, you really need to understand how to handle asthma, for example, right? Because that's something that everybody sees. It's very common. A pulmonologist might not see regular asthma, but you do need to be able to know when to send the person to a specialist, and all of those skills you'll get while you're doing your training here.
Wow.
And we really, we have a lot of great things to offer.
I mean, it sounds fantastic. Now, you mentioned the university type setting. So this is a community hospital, but you still have the opportunity to do quite a few things. So with that said, is there the opportunity to do research if I'm more academic focused, or that's my career path? I would love to maybe be like yourself and get into medical education.
So another great question. So in terms of research, here at GBMC, we have a lot. So first of all, let me just start with, there is a scholarly requirement for all training program. So no matter what you want to do, you do need to do something scholarly, and that's basically your research. And your research can either be patient-based, but here at GBMC, we've got this amazing lean management system that's already focused on quality improvement. And health systems improvement is just one of the best things that we can offer our trainees. There are so many opportunities to do research in that area. So not only do research, but also end up improving patient care. So you can do research. You could pick a clinical topic that you want to do, that you have a question that you want an answer to, and you can spend your time trying to figure out what the answer is. So those are definitely opportunities here. If you were more interested in bench science, where you're going to actually sit there and work with cells, that is definitely not going to be something we can offer here, because we don't have the university component to that. So when you're interested in a community program, it's because you want to work with patients. You're interested in learning that way, which is really important, and you want to do clinical projects.
Well, I can tell you from firsthand experience that I work with some of your recent grads. Wahira was one of your recent grads, and Aman. And I, as a bariatric surgeon, I have a lot of patient data. We have a lot of research ideas. So, hey, if you're out there watching this randomly just to check out Dr. Carr and you are already a resident at GBMC's internal medicine residency program, I have a lot of research projects. I need your help. And those two lovely ladies helped us to write a manuscript that we submitted on some of our work. And it was fantastic. So, hey, I think there's a lot of us out there that need your help. So I'm so appreciative to that. But that is a side note. Now, I want to know more about the mix, particularly the categoricals. How many do you take a year to really give that individualized kind of attention to each candidate?
Oh, so we have 13 categorical spots. So each year, first, second, and third, we'll have 13 residents. The prelims are an additional 6 that we have. So the first intern year, we have 19 residents, and then after that, we have 13. So we do try to keep the ratio nice and small so that we can give them dedicated attention. One of the things that we do, for example, is we have a very robust, much more so than when I was in training, advisee relationship. So one advisor, which will be a core faculty member, will have 4 advisees or residents for either first, second, or third years that they're working with. And they will actually be your true coach through your whole process, which is really amazing. It's just so nice to see that program in place. The other benefit of having small program is that we have, again, in our outpatient setting, I was talking about how they do clinic every 6 weeks. We call them firms. And when you're on that firm, you will work with one attending directly. So that firm will have an intern, a second year, and a third year, and the attending. And so it's just another phenomenal opportunity to have that specific attention and ability to supervise and make sure that there's a second look, as we call it, on the management that you're giving your patients to make sure that they get the best care that they can. Because, again, at GBMC, our main focus is really delivering patient care the way we would want it for our loved one. And so we want our trainees to do that exact thing. And so we really try to create that environment.
Fantastic. This is a superb residency program. Now, with that said, are there, tell me a little bit about the mix of your graduating residents through the years. How many do go off to fellowship? Do they get fellowships? Do they get great fellowships, competitive ones? And how many continue to do primary care internal medicine?
So I wish I had all the data going back. Obviously, being a new program director, I can just tell you sort of what I know. We have had phenomenal placement in fellowships for those that want to go into fellowships. This third year class, actually 100% of them want to do fellowships, or at least they all in their second year said that they wanted to do fellowships. And I think actually as they mature, some of them say, oh, maybe I just want to do primary care. So we match very well in fellowships. We've matched people in pulmonary and critical care. Quite a few every year go into that. They match in nephrology. They match in rheumatology. We've had some people do geriatrics. There's lots of different ways to go from there. I would say really what we'd like to say that 50% of the class goes into fellowships. We really hope that 50% of people will do primary care because we really need primary care physicians in the country, all over the country. And we're going to need them more and more in the future. And there's lots of different ways that people can go about doing that. The other track that we do have, so in our program, we're actually kind of looking at 3 different tracks. One of them is a primary care track. One of them is a hospitalist-based track, actually. So it's sort of the person who wants to actually just take care of patients in the hospital setting, allowing the outpatient attending or the outpatient physician to have that relationship outside and not be torn between outside and inside the hospital. And then, so the hospitalists generally, some of them will be career-long hospitalists, but some of them actually do it for a year or 2 before they go on to fellowship. And then the other track that we're developing actually is this health systems management that I was talking about, the improvement in health systems all around, and that's going to be a special track. But if somebody comes into GBMC and they want to do a fellowship, they don't have to be in one of those 3 tracks. They can be in what we would call this sort of standard approach. So it's kind of great that we have a lot of flexibility. Even though we only have 13 graduating residents, we offer so many different possibilities. The program that I came from, it was a couple of years ago, but the program that I came from had 140 residents, and that was where I was associate program director there a while back. And that was a very different beast, right? You have tons of different things happening all the time. And here we still are able to offer 4 different ways of getting to your goal.
Wow. I love that it is an intimate program and you get to know each other. They get to know, of course, you know, all of the residents. You probably know them very well. They get to know the attendings. They get to establish this relationship, that mentor-mentee relationship. It's critical to really advancing medicine, and feeling comfortable with whoever is mentoring you is critically important. And when you're learning procedures, is there a lot of hands-on with central line placements, chest tubes, suturing lacerations? Is that a big part of the training, or is it very minor nowadays?
So, you know, I think a lot's changed since over the years. The one of the things that happened is it used to be that you had a requirement that you had to have 10 central lines and you had to do all these different procedures. And what came to be is they realized over time that not all hospitals are able to provide that kind of training. So the requirements have totally changed for internal medicine. So really, unless you're going on to do a specialty like pulmonary and critical care, where you are in the critical care setting going to do central lines, you are not mandated to do anything. We have here at GBMC a really great vascular access team. They actually will train our residents, which is so awesome. So they get somebody who is just constantly doing these procedures throughout the whole hospital to be able to train them if they want to have that training. We do have basic requirements for, so imagine somebody's going to be a primary care physician. If they need to do annual exams, physical exams that are particular for screening, they'll have training for that. So we do offer training. If you do the service, if you spend a month doing an elective, 2 weeks doing the elective to learn how to do central lines, and then you're in the intensive care unit and there's a central line that needs to be placed, then you'll have the ability to place that with the supervision of the attending. You know, we definitely are a teaching hospital, so we are here to teach and train. So we really want to try to make sure that everybody gets an opportunity if that's what they want to do.
Dr. Carr, you're making this sound very attractive. If there is any potential candidate out there that's watching is not thinking, well, let me sit up in my chair, let me look at this website again, and let me submit my application. And of course, rank, well, you're not allowed to say that. Isn't that a big taboo thing? You're not supposed to say, please rank as highly. So, but you know what we're saying here. You know how that goes. You want them to rank you very highly because it is a great program. I've worked at GBMC for 7 years now. And, you know, on a personal note, why GBMC for you? Why Towson, Maryland? I mean, your resume here is so impressive. How'd you land here?
Well, thank you for the compliment. So, you know, I was just trying to think about this yesterday because somebody asked me to write a get to know me column, and I was like, wow, I have so much to say. So I ended up actually before medical school. So when I was in college, I was all set to go into business. I was 100% prepared, and in fact, I was going to move to Europe because that's where I was born, and I was going to go and set up this company and do all this stuff. And then one day I decided I wanted to be a doctor. So here we are now. All of a sudden, my path totally changed. So I had a circuitous route to get there. Then I ended up going to medical school in New York, and then I went to residency and fellowship in Philadelphia, where I then joined the faculty. Met my husband, and my husband he's an amazing guy, but he definitely is somebody who we agreed early on in our career that we were going to have one career be the lead career. And so his took precedence, and we decided we ended up moving a lot. So he took me to Guam first, which is a really fabulous place in the middle of the Pacific Ocean if you like tropical islands. And then from there, we went back to Philadelphia, where I rejoined the institution where I had been before. And then we went to Salt Lake City, Utah. And then from Salt Lake City, he was recruited here to the University of Maryland. So we came to Maryland. And I had just gotten to the point where it was a time in my life where I needed a little bit of a change of scenery. I really wanted to focus more on my clinical aspect, you know, with patients. And plus, it's like 5 minutes away from where I live. So it was just a win-win. And I really fell in love with the program, the hospital, and the institution here. I have been so impressed with our administration from top down. You know, our CEO is wonderful. And I feel that they're very good to the people that work here, right? They're very good to the physicians. There's a lot of support for us to really be able to do what we need to do for patients. And then, then the residency program. So now all of a sudden I find myself in my dream job, and who knew? Like I just didn't really ever know this was going to happen. In the meantime, my husband is leaving the University of Maryland and going to the NIH, but we are staying in Baltimore, and he will commute. So I am thrilled.
Oh, well, that's what we all aspire for, is to live our dream jobs. The reason why are we here? Why do we do what we do? You're obviously very passionate, and I would love to learn under you. I think that any residency candidate, in all seriousness, would be just, I'm sure, thrilled and honored to have the experience and opportunity to learn from yourself and a lot of the other esteemed faculty here at GBMC. And if you're looking at it and you're seriously considering it, you should check out the website. It is gbmc.org/internal/medicine-residency, or just Google GBMC internal medicine residency. You can learn a lot more. It tells you a lot about the application process. As she said, we participate here at GBMC in the match, the traditional application process, and it's fairly easy through the ERAS and that sort of thing. Baltimore is an awesome place to live. We are in northern Baltimore, very close to Baltimore. The Inner Harbor is beautiful. We're a close train ride to New York City, Philadelphia, the East Coast, the beaches, great weather. It's an amazing place, and I hope you like seafood because that's great too. So you'll learn a lot about the culture in the area, and I think it's an amazing place if you have a family, or even if you don't and you're single and you just want somewhere really fun to be. This is an amazing opportunity. So good luck to all of you out there who are watching. I remember, like I said, just being so nervous when you're trying to decide where to go. I want the best experience. I want that foundation. And I can guarantee you, if you do choose GBMC and you match here, you should be thrilled that this opportunity will be one of the best of your life, and you will never forget the people that you meet. So if you want more information, check out the website. But thank you to Dr. Carr for being here today. And for all of you watching out there, good luck. My name is Betsy Dovec, and thanks for watching What's Up, Dr. Dovec. See you guys.
Bye.